having a miscarriage as a one-time episode does not necessarily mean that it's going to happen again. This is how miscarriage works. When there is a conception and there's a problem with the formation of the baby in the early stages, nature has a way of doing away with that fetus or the embryo at that point, so that it does not develop into maybe a monster or something. It's called natural selection. If it's not good, it should not form beyond that point. So you have to know that it takes a lot for a baby to form, a whole lot. So once there is a problem at any point, it does not continue. Okay, so that is a single episode of a miscarriage. Many women may have had miscarriages during their reproductive journey. It may have happened before they start having the babies, or while they are having babies, in between one miscarriage or two, as the case may be. Or it may even be after they have had their babies and maybe they want to try the last one or something. So it's not supposed to be, it's quite common, or 25%. So it's something that is there, as opposed to recurrent pregnancy loss, RPL. When you have more than 2 or more miscarriages or pregnancy losses under 20 weeks of gestation. This is the definition. It should also be noted that it may or may not be consecutive. So whenever that happens, it is counted as recurrent pregnancy loss. When you have 2 or more spontaneous miscarriages, whether consecutive or non-consecutive, this is the time for an evaluation to be done, to know the reason why this is happening. And there are a lot of tests that have been mentioned in literature, that's in the medical environment, as per the reason why this may be happening. Commonest cause is usually chromosomal problems. That's genetic problems are the commonest cause. Then there's what we call immunologic problem, the way your own body reacts with the pregnancy in question. Sometimes also infections have been incriminated in this case. Then the environment, also environmental causes. Then what we call hematologic causes. Some people that have hematologic problems, bleeding problems. There are quite a number of tests, but they come in different stages. The first stage is done. If nothing is found, now move to another level, because it's more, at this point, it may be a diagnosis of exclusion. Sometimes, depending on the environment where you are practicing and the availability of equipment to do these tests, it will limit the kind of tests you can do. But if all the tests are done, there will definitely be something that will say, okay, this is the reason why it is so and it's not so. It's a diagnosis of exclusion. You keep on doing all the tests until you find what is responsible. If you find what is responsible, then you administer the medication for that. Then that's where the treatment comes. Sometimes it may even require surgical intervention. Maybe when you have abnormalities of the formation of the womb. Some people have double womb, or they have a divided womb, so that the baby will not be able to stay and all that. So when it's detected, they may need to do certain corrective surgeries before the baby can now stay in the womb beyond 20 weeks. So depending on the cause, treatment options are available. Once it is treated and the cause has been found, there's no reason why it should happen again, because the cause has been found and treatment has been in place. So they can have healthy babies afterwards. That will be all for this week. Till next week, when we'll continue to address your health and fertility concerns. Don't forget to subscribe and turn on your post notification to get updates on our new videos.